At ASH 2023, we had several presentations related to Asciminib, a novel STAMP inhibitor for patients with Philadelphia chromosome positive CML. And one piece that I was particularly involved with was a final report from the ASCEMBL trial, which was a key pivotal trial of Asciminib versus Bosutinib. So the schema for the study was this novel treatment Asciminib, which had been developed from a large phase I study, being compared in third-line therapy versus Bosutinib in patients with chronic phase CML who had had 2 or more lines of therapy. Patients couldn't have a 299 or 315 mutation because of the inability to randomize to Bosutinib. And we've seen this study presented several times. And what we learned in earlier presentations was that Asciminib was superior to Bosutinib in efficacy and also in safety. The main advantages were improvements in the primary endpoint of early major molecular response, followed by subsequent molecular response and late molecular response at the last follow-up, 4 years time point, or 3 to 4 years overall. When we studied this population further, we understood that the tolerability, again, of Asciminib was a real advantage. And in addition, at ASH, we did look at the potential question of what was the outcome of patients who had started with Bosutinib, who were then allowed to switch over to Asciminib, so the crossover. And those patients weren't in the primary endpoints, but they were certainly important to ask. And while there was response, this was, as we looked, a difficult population. They generally had higher levels of BCR-ABL, and of course, they were now delayed in their treatment. So major molecular responses were more limited compared to the overall population in the study. And the durability of response may be an issue. So I think the messages from the abstract were that over longer and final follow-up, Asciminib was clearly better than Bosutinib in this setting, in the third-line setting. Safety and tolerability were as had been previously reported. And the crossover population showed us that waiting and using Asciminib later isn't going to be advantageous to patients. We should be thinking about using it sooner.